Hello, I'm Dr. David Perlmutter. And first, let me say thank you to the Ocular Wellness and Nutrition Society for having me as a guest today, as an introduction to really put forth my ideas in terms of why nutrition is so incredibly important as it relates to eye health. And really, as such, the value of the personalized nutrition practitioner program. It's been said that the eyes are the gateway to the soul. The eyes are the gateway to the brain, that's for sure. We now recognize that brain degenerative conditions are really oftentimes predictable by simply looking at what's going on in the eyes. We live in a world where some 250 million people are suffering from varying degrees of vision compromise, with very common issues like cataracts, age-related macular degeneration, diabetic retinopathy, and glaucoma having a significant relationship to nutrition and other lifestyle issues as well. But nutrition really turns out to be the gateway to be upstream in terms of the genesis of these problems. We know that in America, for example, some 83 million individuals are either pre-diabetic or full-blown diabetic, type 2 diabetes. And that is a metabolic situation for which nutrition choices and nutritional intervention is hugely important. We tend to focus in the Western world, and certainly here in America, on the treatments for our various maladies. But I think it's really fair to say that various maladies are actually not treated in the sense that we're getting rid of them with the standard approach of modern pharmaceutical care. For example, when we give patients a high blood pressure medicine to treat their high blood pressure, ask yourself what happens the very next day when we stop that medication. The blood pressure goes up. So did we actually treat the underlying problem? When we say that we're treating type 2 diabetes by using one of the many medications that can lower blood sugar, again, what happens when that medication is stopped? The blood sugar goes up. So in a very real sense, we are treating the smoke while we are ignoring the fire. The same can be said about how we treat various eye disorders. For example, as it relates to diabetic retinopathy, the treatments that are so widely available, are they effective? Yes, they are. But do we actually treat the underlying disorder? Probably not. We're treating the various manifestations in the eye of the elevated blood sugar. Why is this happening? Why are these conditions that I have just enumerated so common, especially in older individuals? Well, the eye is at great risk for degeneration for a number of reasons. The eye is metabolically very, very active. And that means because of all this metabolic activity, like the brain, it's really at risk because it's producing a lot of free radicals. Metabolism begets the formation of the byproducts of mitochondrial function, including free radicals. And why would the eye be so at risk? Well, it is because the eye is made up of a lot of what are called polyunsaturated fatty acids. These are fats that are susceptible to being damaged by higher levels of free radical activity. And really, this underscores the importance of nutrition as it relates to augmentation or upregulation of antioxidants, the notion of taking antioxidants, and even importantly, more importantly, I think, the fundamental notion of dietary interventions that reduce oxidative stress, that help our bodies actually produce antioxidant to go ahead and quench those free radicals. So yes, it's great to take a multivitamin that we've all heard about that might contain some beta carotene and some copper and zinc and other important vitamins and minerals. But the reality is that there's a panorama of antioxidants that are effective throughout the body to help us quench free radicals. We've been exploring those various antioxidants as they relate to the brain for the past 3 decades. And we've seen the research, of course, you all have seen the research that relates higher levels of antioxidants to eye protection. But I think it's really important to understand that increased antioxidants are just a part of the puzzle. We have to understand and get our arms around the notion that in the eye, there are issues that can actually enhance the formation of free radicals. And it gets back to, where do these free radicals come from? Free radicals come from the function of our mitochondria. When our mitochondria, the energy producers of the cells in the eye in this case, are compromised in terms of their function, then there's a lot more exhaust coming out of the exhaust pipe, and that's what free radicals are. And they damage local tissues, and that is really a cornerstone to a lot of the degenerative eye conditions that we see. So we then have to ask ourselves, well, what threatens mitochondria? We know that that's where metabolic health plays a huge role. When we're metabolically compromised, for example, when blood sugar is elevated, it threatens the function of our mitochondria. Downstream effect, mitochondria increase free radical production. That damages the eye and sets us up for all manner of chronic, degenerative, progressive eye disease. So nutrition then becomes very, very important. We want to look at nutrition not just in terms of how many milligrams of a particular antioxidant it contains, but rather, how does nutrition nurture our metabolic function such that we don't increase the production of these free radicals in the first place? That's actually very important, because the link to compromising metabolic function seems to be inflammation. And this takes us to recognizing the importance of diet in terms of either increasing or decreasing inflammation. The balance of gut bacteria turns out to be really fundamental as it relates to inflammation, because one of the functions of our gut bacteria is to maintain the integrity of the gut lining. When that is threatened, when the gut lining is threatened, and I've got a long way to go to get back to the eye, but when the gut lining is threatened, what does that do? It allows certain chemicals to get out of the gut into the circulation. And what does that do? It challenges the immune system, increases inflammation. That's experienced in the eyes. Inflammation in and of itself is bad for the eyes, but secondarily, by virtue of its effect in terms of compromising mitochondrial function, it increases free radicals, and we set the stage for eye degeneration. So what I've just said takes us away from the notion of treating glaucoma, treating diabetic retinopathy, treating age-related macular degeneration. Hey, I'm all in favor. But we are talking about what is upstream. What is leading to these issues in the first place? The biggest lever we can pull is via nutrition, because it's nutrition that tends to put the fire out. The treatments that we have for these conditions are great, but in a sense, they're treating the smoke and not the fire. Desmond Tutu had a quote once, and I'm going to paraphrase. He said, yes, it's important to pull people out of the river, but it's equally important, if not more important, to ask, why are they falling in the first place? We know that nutritional choices here in America are not great. We know that, for example, 58% of calories that Americans consume today are coming from ultra-processed foods. These are foods that threaten metabolic health, that are associated with increased risk for high blood sugar and full-blown diabetes, and that are pro-inflammatory. All of these things have direct consequence as it relates to our vision, as it relates to our eye health. And these are the kinds of things that you'll learn in the personalized nutrition practitioner program. You'll learn how to balance metabolism via diet, how to increase the gut bacteria's ability to produce healing chemicals via diet, how inflammation is so strongly influenced by the health and diversity and functionality of our gut bacteria, and connect the dots. How does that affect vision? So, yes, metabolic health is fundamentally important for eye health. That's a given. And frankly, it goes well beyond the role of diabetes, full-blown diabetes, as it relates to visual loss or threats to vision in the first place. It's not as if the only people whose retina, for example, are threatened are people with diabetes. Being pre-diabetic is a threat to retinal health. Being a little bit insulin insensitive is a threat to diabetic health. It's a continuum. Nothing suddenly happens when fasting blood sugar is greater than 120 or the hemoglobin A1C is greater than 6. It's not binary, it's analog. These changes begin to occur even before diagnosis of diabetes is made. So it's really so incumbent upon all of us to keep ourselves and our patients in the best metabolic health possible. Well, I hope you found value in these comments. I certainly enjoyed sharing them with you today. And I'm so excited that we are forming this relationship and are opening up this incredibly important channel to bring nutrition and nutritional awareness and nutritional intervention into the field of eye health. I'm Dr. David Perlmutter. Thank you so much for having me today.